I talked about economic growth. We've never done that at the expense of a healthier California. And I think that's really important. It's not either or. We could talk about that in the context of COVID, but let's talk about it specifically in terms of health care. We are still on path to become the first state in U.S. history to provide universal health care, regardless of pre-existing condition, ability to pay, regardless of your immigration status, health for all. We're going to get it done this year. I want to thank Senator Durazo, so many others that have long-time champions for this. It's a big deal. I also recognize that COVID is not behind us, and this is a big deal to keep our mind focused and sharpened. As I was driving over here, turned off the TV, there was Dr. Fauci reminding us 4 days in a row with cases now over 100,000. Our positivity rate came in this morning at 4.4%. Interestingly, Florida was at 12.8%. Our case rate is about 152.8, which is a third of New York's case rate. And I say that not as a compare and contrast from a competitive frame, but a compare and contrast of preview of things to come. We have to keep our mind focused. You've got the subvariant of the sublineage of the subvariant now. This B12 has got a B12 1.1, some derivation that only Dr. Galley understands. But will become, common knowledge in a few weeks or months. So we want to maintain that vigilance, and that's reflected in this May revise. And it's also reflected in the plan. We were the first state in America to put out a smarter plan, an actual plan. How do you live from a pandemic mindset or move into an endemic mindset? How do we live in the endemic realities where we can maintain our surveillance, maintain our capacity to move quickly and efficiently and effectively? And that's reflected in detail in the plan, and it's reflected in this budget as well that we are requesting of the legislature. I don't know that there's anything more personal for those with children, parents, or more universal in terms of a unifying issue than addressing the issue of wellness, not just physical, but mental health. And I want to remind you, and I remind people all the time, I even remind some of my colleagues in the legislature, of what they did, what we are doing, what this state is doing. No other state in the country is doing this. We committed $4.5 billion on universal comprehensive service and screening for everybody 0 to 26 in the state of California. We did that last year, and has components that connect to the schools as well that are deeply connected to the strategy. We think we can do a little bit more because as we fully implement, we're in the process of implementing that strategy. We want to do some things with more urgency and really focus on what's happening with technology, people's moods, stress, lack of sleep, feeling isolated, lonely, suicidation, broader issues. They're real, they're raw. There's not one of you that I imagine not quietly shaking their head. You get it. So we have to do more and better, and we have some proven strategies and solutions. We've put up some toolkits that don't exist anywhere else, some remarkable videos. Please take a look at these videos we put out. Dozens and dozens of culturally competent videos, instruction for parents, for teachers, for kids themselves. And we want to build on all that, and that's reflected in this additional $290 million we're requesting. Health, understandably, has expanded even deeper in one's consciousness as it relates to what's happened, what happened years ago at the Supreme Court, but what's now manifesting as a consequence of what happened over the last few years with the politicalization, from my humble perspective, ever since Mitch McConnell delayed that nomination and ultimately just exposed the harsh realities of hyper-partisan politics and tipped that third appointee in Donald Trump's hands, the court, and this is what we get. Unenumerated rights, going back to 1780. Is it interracial marriage next? Well, that's the senator from Indiana who says perhaps. Or is it gay marriage? Well, that's probably 2/3 of Republican senators. Or is it contraception? That may be what the Mississippi governor was unable to answer as it relates to IUDs, Plan B, and other contraceptives. That's the world we're living in. How can California future-proof itself? How can California do more for women and girls? Do more to advance our values? We put this out 2 days ago, building on what we did last year in terms of supporting reproductive health, addressing some gaps, addressing education opportunities. Again, we believe in equity, we believe in fairness, which means access and affordability, and that's advanced with incredible leadership. I mean, Speaker His office has been great, but perhaps no one better than our own pro tem leader of the Senate, who's also the principal advocate for a constitutional amendment codifying our reproductive rights and freedoms here in the state of California. And I just want to thank her and thank the entire leadership of the Assembly as well for their support in the past. And that includes, just as a quick reminder, on co-pays and deductibles and addressing issues of access at our universities, something that was stubborn. There were some efforts in the past that didn't get across the finish line. We were able to do that last year. And of course, addressing the issue of maternal and infant health. And I think that was part of the Momnibus, thank you, Senator Skinner, program, the Women's Caucus, across a spectrum of supports. There's not enough time and too many pages we'd have to burn through to go through the details of that remarkable plan. Though I do want to make a deep point here. California is a pro-life state. See, we believe that, well, let me back up. I think there's a lot of folks out there that are pro-conception to birth, but they fall wholly short of being pro-life. Because if you're pro-life, you'd support prenatal care, you'd support black infant health, you'd support child care and preschool. If you're pro-life, you'd believe in science, you'd believe in climate change. If you're pro-life, you would support home visiting. If you're pro-life, you'd actually support common sense gun safety. If you were pro-life, you would be expanding after-school and preschool programs. In every single one of these cases, universally, these same folks that claim or hold claim to this pro-life side are cutting those programs, opposing expansion of those programs in every single case. So spare me their mantra on being pro-life. They don't deserve that status. Not unless they are champions of things that are up on this board. We are, and I'm proud of that. I'm proud of this legislature. I'm proud to represent this state. People of the state of California made this happen. Those are the things we're doing. That's a real pro-life agenda. It's a serious moment in American history. And I'm really proud of how serious this state and our legislative leaders take this moment and continue to build on so many of the programs that you see reflected here today. And please, as well, if you're pro-life, how the hell is this possible? California has the lowest death rate per capita of all populous states in America. Just look at that. If we had Arizona's, just as an example, if we had Arizona's death rate in terms of the approach they took to saving lives on COVID, certainly Florida and Texas, just looking at the death rates in Arizona, we would have almost double the number of people that died because of COVID. Double. About 90,000 people tragically lost their lives in the state of California, 170,000, just shy of double. If you used the Arizona framework, would have died in the state of California. So forgive me again, spare me this notion of being pro-life as opposed to pro-birth. Proud of California.